Hello, my name is Dr. Viki Male and I'm a reproductive immunologist at Imperial College London. That means I study how the immune system affects fertility and pregnancy. So one question I get asked a lot at the moment is, I'm trying to conceive or I'm pregnant. Can I get the COVID-19 vaccine? And the answer to both of those questions is yes. In particular, the Royal College of Obstetricians and Gynaecologists now recommends that you get the COVID-19 vaccine if you're pregnant. And the reason for this strong recommendation, which is quite new, is because we're getting more and more evidence about the dangers of COVID-19 in pregnancy and conversely about how safe the vaccines are in pregnancy. So we know that people who get COVID-19 late in pregnancy are more likely to need intensive care themselves. It's more likely that their baby will be born preterm or stillborn, or that their baby will need intensive care. And so to avoid these bad outcomes of COVID-19 in pregnancy, we might be quite keen to get the vaccine. But of course, people then ask me, is it safe? And we have more and more information about that now. We have 5 large studies, by which I mean hundreds or thousands of people, and a number of smaller studies as well, that have tracked the outcomes for people who got the COVID-19 vaccine while they were pregnant and where they've already given birth for their babies. And we find no increased risk of miscarriage, stillbirth, preterm birth, congenital abnormalities, or the baby being smaller than we would usually expect in people who've had the COVID-19 vaccine. And so this underlies the new, quite strong advice that if you're pregnant, you should protect yourself and your baby by getting the COVID-19 vaccine. Now, another question I'm sometimes asked is from people who have had the first dose of the COVID-19 vaccine and then they found that they're pregnant. Should they go back and get the second dose? And our guidance says that you should go back and get your second dose, but it's up to you if you want to get it when you're due to have it, or if you would feel more comfortable waiting until after 12 weeks of pregnancy. The evidence says there's no reason to wait until after 12 weeks, but equally, if you feel more comfortable doing that, we think that it's not harmful for you to take that decision. Another thing that people quite often ask me is, are there any benefits to my baby if I get vaccinated when I'm pregnant, or maybe if I'm breastfeeding? And the answer is that there potentially are. We know that the vaccines don't cross the placenta and get into your baby, but the antibodies that your body makes do. And from what we know of other vaccines, that might potentially give your baby some protection when they're born. Similarly, we know that the vaccines don't get into breast milk, but the antibodies that your body makes do. And again, that could give your baby some protection against COVID.